Good evening. My name is Debrew Carthen, and I am the Vice President of SEIU-UHW AFRAM. I'd like to thank you all for joining us this evening for our Black Expo. We have some dynamic speakers lined up to share with you this evening, and we really want you to just join in with us and be family. And consider this a safe environment to speak. There's a lot of things going on in this world today, and we really want you to just feel open and know that we are here to explore, understand, love on each other, wrap our arms around each other virtually, and just let each other know that we are here. We are so excited to have you here this evening with us. And we just want you to join in, speak up, and be involved. Once again, I just want to welcome you. And let's get this Black Expo started. Thank you.
Thank you, Debrew. My name is Georgette Bradford. I'm the president of UHW AFRAM Caucus. And again, like Debrew, I want to welcome everyone for joining us for our Black Health Expo, one of our featured events for Black History Month this February. As we all know in our community, this pandemic has weighed heavy for many peoples of color, but for African Americans, it has highlighted many disparities in healthcare that we have always known have been there, but have just been exacerbated by this COVID pandemic. So we wanted to have a discussion, not just about COVID and its effect on the Black community, but also those other health issues that aren't always spoken in the mainstream that deeply affect us as a community. So we will be talking about COVID, how it affects the African-American community. We will be talking about Black mental health and the stigma that is on Black mental health in our community. And we will also be talking about Black maternal health, a very important and critical issue because that is just the future of us as a community, our mothers, our children. So I'm looking forward to a very dynamic day. We have some phenomenal panelists to be speaking with us today. I am overjoyed that they've joined us, and I can't wait to hear what they have to offer and the dialogue that we spur. And hopefully, moving forward from today, doing more research, being more active, getting more education about these issues so they are no longer in the dark. So I would like to welcome our first panelist to speak to us about the COVID impact on our community. And our first panelist is Yusef Miller. Yusef is the founder of Mosques Against Trafficking, co-founder of the North County Equity and Justice Coalition, a member of the Racial Justice Coalition of San Diego, a member of East County Justice Coalition, board member of the Activist San Diego, and board member of the Islamic Society of North County, Escondido Musullah. Upon retirement from the armed forces, Yusef filled his time with social justice activities, first through interfaith teams, Escondido Together, POA Interfaith Team, San Diego Regional Interfaith Collaborative, as well as the District Attorney's Interfaith Advisory Council and the San Diego Anti-Hate Crimes Coalition, fighting disparities on all fronts: race, religion, gender, immigration status, just to name a few. Well, we asked Yusef with us because the fight that he is doing now is educating and spurring that dialogue about COVID, its effect on our community, and how we get through this pandemic as a community. So once again, welcome, Yusef.
Thank you. Thank you everyone for having me. And it is my pleasure to communicate this serious pandemic issue within people of color. Now, just from the outset, there are three types of people when it comes to the vaccination of COVID. There are the people who are absolutely not going to take the vaccination. There are people who are on the fence, and there are people who are absolutely going to take the vaccination. I am not here to force anyone to take the vaccination that does not want to. But if you have an inkling to do it, you need more information on why you should, then I'm here for you, and to make sure that you get that information and make a wise decision, an informed decision on whether you will or will not take the vaccination, which I encourage all of us to do. For our brothers and sisters, whatever background you are, if you don't want to take the COVID vaccination, what I beg of you is to maintain your 6 feet distance, maintain your hygiene, maintain wearing masks, and don't gather in large groups. Do this for yourself and for your community if you're dead set against the vaccine. But I implore you, please listen to these following words, and maybe this will help you out. As was said earlier, the people of color, we have a high rate of infection and death when it comes to COVID-19. And a lot of people may think, wow, how does COVID-19 know whether you're Black or Latino or white? It doesn't. The virus is not racist, and it doesn't do that. We are the ones who do that. That is not the function of the virus. What happens is that people of color have comorbidities. Comorbidities mean associated disease processes that exacerbate COVID-19. So therefore, when you look at people of color, particularly Black and brown peoples, we have a higher rate of hypertension, diabetes, cholesterol, being overweight. These things, they factor into how you survive the COVID-19. So I want to get to something here locally in San Diego. This impact on people of color is national, nationwide. Black and Latinos are affected more than a lot of other ethnicities. But let's zero in here in San Diego just to make a point. Our Latino brothers and sisters, Latinx brothers and sisters, of the death rate, they're 43.9% of the deaths of COVID. This is as of today. These are statistics I'm giving you as of today. Our white brothers and sisters, 37.1%. Our Black brothers and sisters, 3.9%. Now you may say, oh, 3.9%, phew, 3.9%. But the Black population of San Diego is only 5%. So 4% of 5% of the community. So of the people who are dying of COVID, we're almost equivalent to our population in the city. So this is really disturbing because a lot of Black people are not going to get their vaccinations. We generally don't trust the healthcare system or scientific systems that appear to be experimenting on us, and it's a justified reason why we do. It's a historical background and a historic baggage that we have. But I wanted to explain to you how deeply this impacts our community, Black and brown, how we need to take this more seriously than other people because of our comorbidities. Now, what is this baggage that we have when it comes to COVID-19? Back in the day, if you go back from slavery on up to today, Black people and people of color have been experimented on with the permission of the medical establishment, with the permission of the scientific establishment. And as a self-defense, we are less trusting. We don't go to the hospitals unless we're bleeding or broken. Well, we won't go until we're on our last straw. And if it's experimental, forget it. We remember the Tuskegee experiment, when they experimented on African-American males with syphilis and allowed the syphilis to ravage the bodies without giving the treatment, even after it was discovered and developed. And a lot of people don't know, the people who do know about Tuskegee experiment don't know that it was also mimicked in Guatemala with our brown brothers and sisters. They took that Tuskegee experiment, they didn't call it Tuskegee in Guatemala, but they also did the same experiment on our Guatemalan brothers and sisters. So we have a historic a trauma that is from this medical field, and this is what we're here to try to dispel and comfort, so that African Americans and our Black and brown brothers and sisters will feel more comfortable coming to this to the fore for this really important pandemic. Now, what's different from Tuskegee times to today? The difference is there are a lot of African American and Latinx people involved in the process than it was in the 1800s, in early 20th century, the 1920s and 30s. There's a lot more Latino and Black people. For example, in this vaccine, we have people not only from Black and brown people, but all the way up to the vice president of the United States. We have Black and brown nurses, doctors, scientists, policymakers, all involved in this. So we have watchers throughout this process. So I want to dispel the idea that there's some group out here where we're not involved in it. We have no insight on it, and they're experimenting on us with this vaccine. This is not the case. I spent 24 years in the military training. I did 5 years medical research and 3 years of cancer research. And I understand how research goes. I looked at the research here, and it is a solid research. So I just want to dispel that kind of myth. Now, back to the comorbidities. I want to make sure that everybody understands the multiple times critical it is for you to have a comorbidity with COVID. For example, if you have asthma and COVID, you're 1.5 times more likely to develop a serious condition and die. If you have hypertension, you are 3 times more susceptible to getting a serious infection and dying. If you have those two and obesity, 3 times as well. If you have those 4 and chronic kidney disease, 4 times as likely. If you have those plus heart attacks, you know what I mean? So it keeps going on and on. The more comorbidities, the higher your chance to get sick and the higher chances of from the infection. And we see in the Black and brown community, we really suffer from these comorbidities. It's not that we are weaker people, that COVID doesn't like Black people, is trying to take out Black and brown people. It's our comorbidities along with COVID-19 that makes the survivability goes lower. So please, if you are on the fence about this COVID-19 vaccine, about your precautions against COVID-19, please look into the data, not into the Facebooks, not into any of those things. Look into the data. And the data, if you don't understand it, there are people from the Multicultural Health Foundation. For our Latinx people, we have the a Latinx Foundation who works with us, and they also do this talk to our Latino brothers and sisters. So we want to make sure we dispel these myths that we need to be vaccinated. I've had my 2nd dose. People are thinking if you get the 2nd dose, you're going to grow a 3rd arm, or it's going to change your DNA, or it's going to put a little microchip inside you. And that, the funniest to me is the microchip is going to follow you around. I can't even get my cell phone to maintain a charge. Even now, it's plugged up so I don't run out of charge while I'm talking. So a chip that's inside of you recording your every move. I mean, I lose signal on my cell phone. How often can this little chip lose a signal if it's in? So please don't fall for these things. These are counterproductive. And for Black and brown people, it is deadly if people promote this kind of idea. This is our health. This is our family health. People 65 and over are more susceptible to getting the infection and dying from it because they have a weaker immune system. So right now we're vaccinating 65 and above, and we are going to expand that. Once we get a hold of our more susceptible people, they'll start expanding it to other groups. So hopefully I didn't take too long here for the rest of the group, and thank you for having me.
So Yusef, you did great.
Yes.
You do have some more time, got some cushion. So I would like to ask if you could elaborate a little bit on some of the work you've done in your community, as far as dispelling some of the myths and getting out the education about the vaccine through your organizations.
Yes. So what I do is I provide Zoom talks, whether it's individual, family, organization, youth groups, women's groups, male groups, any kind of groups, organizational groups. I do these kind of talks all the time, and I go down the list of myths that are out there that people they have when it comes to COVID-19. One of the talks that I had in Solana Beach, I didn't even know it, but I gave this presentation for about an hour, and 56 people chose to get their vaccination the next weekend. And then they went there. We got 5 doctors to come to them, not even go, they were 65 and over. We got doctors to come to them, and we vaccinated all 56, and they're in line to get the next vaccination. So sometimes it's simple as information, correct information about what's going on. We're not a fearful people, but we don't want to be taken advantage of. And sometimes we're taken advantage of with social media. So people like us, the Multicultural Health Foundation, our health professionals, our doctors and nurses, please go to the sources when it comes to information on COVID-19 and the vaccine.
Thank you, Yusef. And just you being here with us is a testament to why it's so important to hear from people that look like us about this. If you could elaborate a little bit more on the importance to really validate and acknowledge where the mistrust comes from, and how if we don't do that, it's going to be that much harder to get through to people and give them the education they need to make a educated decision on their own.
Exactly. I mean, we can't put the cart before the horse. This trauma is real, and this distrust was earned. So we're not going to just throw that away because we have families to look after. We want a nation of people who are going to be healthy. And we have in our track record where we're experimented on in gynecology and in microbiology, in psychology, all of these dermatology. You can go on and on. Even in our babies, before our babies were born, there was this one doctor, Dr. Sims, who is most notable for his experimentation on the genitals of Black women and the torture that he put these women through. A lot of people don't know the other tortures that he done to Black males and to Black babies. One of the things he did was he thought that the Black babies, their skulls didn't increase or grow in size like white babies' skulls. So he took a shoe awl. You don't have to know what a shoe awl is, just think of a screwdriver. He took a screwdriver to try to loosen up their skulls. 100% mortality rate, as you can imagine. But he didn't care about throwing these babies away because they were African American. So we have this in our trauma. We have this in our heritage, in our culture. My grandmother talks about things like that. She's from Alabama. She talks about things like that. So we have that, and it's real. If we don't deal with this real concern, then we won't have people go to this to get vaccinated. And then in turn, we have more loss of life in the Black community.
And I do see a question in the chat here that kind of speaks to the comorbidity piece, kind of tangentially. What would you say to other Black men about going to get regular checkups so we're not having those comorbidities that are making us that much more at risk for COVID?
I think Black people, Black men and Black people in general should do an annual Black people gather health resource. We get together annually, at least, to work out together, to talk about our cholesterol levels, to talk about our blood pressures as of late. We need to make it part of our culture to take care of our health. It is that serious. We have Black males dropping dead left and right from strokes and heart attacks and people with diabetes. We have all of these things going on, and it's so pervasive that we need to be intentional when it comes to Black health. So that's one of the things that I was thinking about starting myself, is that do you know how people do ice water challenges and all that? No, let's do a health challenge. Let me see, what is your cholesterol, brother? What is your last blood pressure, brother? You know what I mean? These kind of things, because it saves lives. It's not just a cool thing to do, but if we normalize it, then we can keep people on the check, keep it on the march. I mean, how many miles have you walked or ran today, brother, sister? You know what I mean? So these kind of things is really important for us. How many, and then on the flip side, how many hours did you sit on the couch today, brother? Because I'm telling you, you have to work just as hard to get out of shape as you do to get in shape. And if you're out of shape or your health is failing you, you worked hard to get there. You did. So we want to do the opposite, work hard to get out of it. It's something that we need to incorporate in our daily lives.
Great, I love it. Making it part of the village. I love it. We may have to do that, AFRAM. So put a pin in that every year, health challenge. Are there any questions in the chat for Yusef Miller about the work he's done, as far as in his community with his organizations and also around COVID? Have you taken the vaccine yourself? I saw that question in the chat.
Yes, I've had both vaccines. I mean, both series. So I had the first one a month ago, and I had the second one just a week ago.
And the other question I would have for you is, did you go in hesitantly to get the vaccine? And just being fully transparent, or did you just go in and say, you know what, I'm good, I'm gonna get it, I have no worries? How did you reconcile going in to get it?
I had no worries. I wanted to walk the walk as I talk the talk. I looked at the science before I went to go get it. So I didn't just go in blind to say, hey, let me have Black people follow me like the Pied Piper. I looked at the data. I talked to the doctors. And like I said, I have 24 years of medical research background. Well, 24 years of medical background and 7 years of medical research background. So I looked at all of that, digested it, and saw that it was good. And I looked at the policies as well. So then I went in fully comfortable about my people following me. That's more important, actually. If I was going and just saying, let me just try it out, that'd be one thing. But I'm comfortable with my people following me, my children following me, my wife, my grandparents, my grand uncle 75. Him and his wife just got a second dose. And I'm comfortable in getting them to do that. I have no reservations.
I'm so happy to hear that. And I see in the chat too, something that kind of speaks to, again, the importance of having someone like you here talking to us is advocating for ourselves, talking about this to each other, but also importantly, seeing individuals of color as physicians, as researchers, so that we can advocate for us in those spaces. So we know that someone that was part of doing the research, as you had talked to earlier, was advocating for us while that process was going on.
Exactly. And from them all the way up to the Vice President of the United States, we have eyes on this whole process. So we are covered the way we weren't covered in the 1800s, in the 1700s, in the early 1900s. We're covered much more than we were at those times.
So I would ask you this question. Oh, here's a good question, actually. Is there currently a movement to provide scholarships to Black young men to complete medical school and become physicians to treat Black males to save their lives by treating preventable diseases, a leading killer of Black men in America?
I've not heard of a particular scholarship for that. I mean, it's a great idea, and we should promote our past and present physicians who are doing great work out here today, as leaders and examples for our children to follow. We have great doctors here in San Diego. We have Dr. Aflalo, we have Dr. Wood. We have so many Black doctors doing the great work out here today, and nurses and scientists and technicians. We need you to be in these fields so we can do great work. You're just going to do great work because you're an African American and you're motivated to do it, but we also need you to be representative. People need to see you. When they say doctor, they don't think white guy, right? That's what most people think, the doctor, the greatest scientist in the world. And we want you to think, hey, he might be Black, he might be brown. You know what I mean? So we need those representations. And when we have them, we need to celebrate them. We need to celebrate them when we have them.
Now, for you, when you did your research and you looked at all the different vaccines, the choice that you made, was it based on what was available, or did you really make a concerted effort to choose a vaccine based on the research you did, as we have more coming out?
It was with what's available, and what was available was Pfizer and Moderna, and they're identical, nearly identical. So what they have in them is nearly identical. The only thing that's different is the storage temperature and how soon you have to get the second dose. And they're still nearly identical on that. Moderna, once you get the second shot, you are 95% protected, and the other one is a slightly less. So when I looked at both of them, they were nearly the same. My sister asked me the same thing all the way in Pennsylvania. I'm originally from Chester, Pennsylvania. She was like, what's the difference between this one and that one? And I broke it down to her in a way that she could understand. And there's basically no difference. The Johnson & Johnson one that's coming out is different in that it's using a piece of the virus, number one, and it's a weakened form of the virus, right? But also the effectiveness is far less. It's like in the 65 percentile. Although it's a one shot, a lot of people saying, I'm waiting for the one shot. Yeah, you're waiting for the one shot. Okay, I'm not trying to convince anybody otherwise, but it's 65% effectiveness versus 95% effectiveness. So this is what the issue is. And once you get the second shot, it does not mean you can't go without your mask or wash your hands or anything like that, because that 5% will take you out of here. It'll take you all out of here. So no matter if it's 5, 6, or 7, right? We want to protect ourselves as much as we can. So these conspiracy theories of, I heard the term plandemic and all these kind of things like that. These things are dangerous for Black people to get involved in these ideas. We stay on the ball, take care of our health, and get the vaccine. And if you're not getting the vaccine, I'll say again, maintain your 6 feet, maintain your hygiene, maintain your mask, and don't gather in large groups. Please, please, please.
Thank you so much. That was my next question, was post-vaccine behavior and what we should be doing, and not the people talking about being afraid of post-vaccine parties and get-togethers, right? So I'm glad you mentioned that.
We saw over the holidays, people got together and they spiked just like we anticipated. Before the holidays, we anticipated Thanksgiving, New Year's, Christmas, spikes. And it's no joke. It's really no joke. So we can't play around with this, because a lot of times you may be safe, but you have taken the life, sorry to put it this way, you may have taken the life of an elderly loved one or an elderly friend or an elderly stranger. So let's be smart about it and wear it not as a mandatory item that you have to have on your face, but act of love. We don't think about it that way. So we should term it that way. This is action of love. I love you, therefore I'm masked in front of you.
Well, thank you so much, Yusef. This was wonderful.